Oh yeah, I know. I'm in game day attire, but I'm seriously more concerned about you right now because right now the Browns are in a good place. They actually look like they might be in the playoffs. They do a little Jacksonville hookup and they might be all right. So yeah, I'm in my gear and it's game day today. Don't get it twisted, but I'm worried about you. You failed. You failed the NGN NCLEX. You failed your NCLEX. You are depressed. Yeah, because your whole family was depending on this. You had a job lined up. I just talked to someone who was in tears yesterday because she got a note from her hospital where she was gonna work that they can no longer hold her ICU position. I had to hug and console her about the fact that that just ain't for you, but something better is. And I'm your girl, so I'm gonna get you a better job anyway. So I get it. You had that whole party with the stethoscope on the cake. You envisioned that by now you'd be working. You're broke, busted, disgusted, can't be trusted. You know how much I get that? I had my car repoed when I was in nursing school. So I get all of that, okay? I had the welfare and the food stamps and the Section 8, and I even had a baby daddy whooping my ass at some point, okay? So I done been there, done that, t-shirt, sun visor. I'm just trying to help you. I am trying to get you to understand it's not over. You ain't dead. God woke you up and you about to learn how to pass this test. But because you failed, I have to give you 3 things that will make sure that you never fail again. So these are 3 things you have to do. No, you don't think maybe I might try. No, you have to do these 3 things in order to be successful in the future. You got 3 things. Here they are. You got to know why you failed. You got to know what you failed in. And you got to know how to never do that shit again. Y'all got me? Why, what, and how. That's that. That's what I'm here today for. So let's tackle the why. Why did you fail? Well, it's not one reason. No, it's not because you and a baby daddy had a fight. Nope. It's not because you had a baby and it was right at the time of delivery of your test. Nope. It's not because you were going through a divorce and had some trauma there. Nope. It wasn't even because your precious mama died. Nope. It wasn't even only because you went to a bad school. No. But all of these things together collectively truly did make for a really bad test outcome. So let's look at some of the highest risk factors for people who failed, right? Because that's going to answer your what, why? Because I told you got three ways you need to approach this so you never fail again. You need to know the why, the what, and the how to plan ahead. Okay, here we go. The why. You need to know your personal risk. I said it before, I'm going to say it again. If you were not born in the United States, you have one huge risk. That is called English second language student. It doesn't matter how many languages you speak, just roll with me. What it means is that when you were born, English was not the first language in that ear of yours at birth, okay? So you have to understand that's a risk. If you were born in the United States, currently the passage rate is about 80%. If you were born outside of the United States, it's barely above 40%. You feeling me? You got half the rate there, okay? So it doesn't mean you can't pass. Don't get it twisted. I'm an optimist. I'm here. You gonna pass. My specialty in my PhD program was English second language. So you gonna pass, but it is a risk. Another risk, y'all gonna be shocked. Another risk for why you just failed is if you were an LPN or LVN and you were trying to take an RN test. Oh, they have such a high failure rate. Yes, and this is a very little known fact. The failure rate for LPN or LVN to RN, also called a bridge student, is very high because this LPN who's trying to be an RN works too damn much to study for this test. They work a lot. How come I know that? Because they're a nurse and we need nurses and the money is good and they're traveling and they're signing contracts and they're doing doubles and they're mandated because they can't get anybody to relieve them. I get that. You're going to have to figure out how to change that, because I tell you, when you're approaching this test next time, you should not work more than a good 2, maybe 2.5 days a week. We always say 24 hours a week is about right, okay? Not 40, not 50. I talked to somebody the other day, did a consultation, they said 60. How in the hell did she think she was going to pass? Another thing to do, LPN or RN, is if you are working like a crazy woman or crazy man, make sure the week of the test you take off. That's for everybody, but especially the LPN or RN. The other problem with the LPN trying to get their RN is they take their bad habits to the test. Oh yeah, oh yes, honey. Which bad habits do they take? Number one bad habit, infectious disease. Infectious disease precautions are never followed in the facilities a lot of the LPNs work in, so they don't know to follow them in the first place. One of the things I tell my LPNs in my class, I say, listen, LPN, when you pass this LPN test, take your behind to a hospital and learn the right way to practice. You can do some nursing home on the side. You can do your little long-term care on the side for the little extra money, PRN, but take your behind right out of school to a hospital. Learn the right way so that when you go to RN school, you know the basics, because the LPN to RN fails quite a bit. They work too much. They take bad habits that they learned at their job to the test. And here's our other thing. They underestimated how hard it was going to be, because they think and remember and reflect, or at least they think. Sometimes you don't remember correctly, but you thought the LPN test was so easy. How hard could this RN test be? Because after all, I went to a bridge program, and when I got in the bridge program, they taught me exactly what I needed to know for the RN test. They didn't give me no more, no less. Actually, bridge programs suck because they do not go over the basics. Many LPNs have forgotten or never learned the basics because they're in these stupid facilities and working very, very poor conditions. So they never learned the basics. And now you skipped over the basics, talking about we got a bridge program for you. Come in here and get 10 months, you get your RN. Come on in here in 15 months, you get your RN. That's a microwave. It's never going to be the way you need it. You need it kind of like a crock pot. So if you didn't learn it originally, you're going to learn it now because you failed. So we got to get you together. It's okay, but you got to know, do this differently. Okay. Know your personal risk. What are we doing? We're doing it 3 ways to never fail again. You got to know why you failed. You got to know what you failed in, and you got to know how to never fail again. That's what we're doing today. Hello. The third personal risk factor for why somebody might have failed. I need you to know that if you ever failed HESI, even though you ultimately passed HESI, if you ever failed HESI, if you ever failed ATI, if you ever failed a class in nursing school, or worse, you went to a bad nursing school to begin with, which is about 80% of the schools in Florida. So Florida students, I'm talking to you. Your schools suck ass. If this is you, you know, oh, okay, Dr. Shelley said I never really learned the basics at all, because failing HESI, failing ATI, failing a class in nursing school says that you are struggling with some of those basics. Now, here's our problem. If you went to a bad school, a lot of students I talk to, they don't know what makes a bad school. Here's what makes a bad school, nothing else. I don't want to hear about how your teachers quit. I don't want to hear about how your dean disappeared. I don't want to hear about how you didn't get clinicals. All of that is interesting and not real fun. Here's what makes a bad school. They have a pissy, poor, sucky passage rate on the NCLEX. And you can find this out for every single school just by going to your board of nursing and looking their asses up. So if you look up, I'm in Ohio. If I go to, let's pick a school out the blue. If I say Cuyahoga Community College passage rate, boom, the board of nursing will tell me. If I say Hondros passage rate, boom, the board of nursing will tell me. So I had a young lady on the phone, again, went to Florida school, one of them stupid schools. I said, is it a good school? Well, you know, I think we learned pretty good. She don't know what she don't know. So I said, okay, well, let's find out. I looked up the passage rate. The fucking passage rate was 26%. Do you think that precious student was prepared to take this test? Oh, hell no. And true as shit, she failed. Okay, so come on now. We got to look at what is it at our own risk, our personal risk. Doesn't apply to your girl. Don't apply to your guy. It's you, baby. It's your personal risk. What happened to make you fail? Here we go. A lot of my students, not my students because I'd kill them, a lot of students that I talk to, because you do the little $25 consultation, a lot of students that I talk to failed because they only focused on questions. They bought some software, and the most common software that they fail with, I'm just being real now, don't shoot the messenger. The most common software that they fail with is Archer. They go by this Archer. Archer tells them that they have a really good chance of passing. Archer tells them that 60 and 65 is good. And here's the thing, the score you would get on Archer, let's say you got a 60% on Archer, you turn around and do a UWorld test, you're gonna get 40%. Which one is more accurate? You figured out, you the one failed. So Archer, I'm sorry, personal opinion, don't like it, it sucks. It might help some people, but you the one failed, so you the one I'm talking to. So if you bought Archer, don't bother with it again, okay? I really swear by UWorld. They don't pay me. I don't know what y'all think because I always talk about UWorld, but I don't take no money from UWorld. I wouldn't take no money from UWorld. I don't need no money from UWorld. I got enough money to please me, and I don't have to suck nobody's butt to promote nothing. So listen to me. Why can I personally say UWorld is better? Well, because I've done all the software, and I know for a fact that UWorld is more preparatory for the test than any other software I've ever seen in my life. So you can take it and leave it. I don't really care, but you get what you pay for, and you're the one that failed. So I'm the one trying to help you. I don't want you to do this again. If you tried Archer, put this shit down. Questions only are the worst. Questions are important, but you need to get content. Content is only going to be achieved through watching videos. Doesn't have to be mine, but it definitely has to be videos. Okay, here's another reason why, because we're doing the why right now. We're going to do the what in a minute, but we're doing the why right now. Another reason why students fail is life happened. Oh my God, I can't tell you how many times I talked to this student. They call me up and they tell me, well, at the time I was going through a divorce. Well, at the time I had just delivered a premature baby and was at the hospital pumping and trying to feed the baby, and the baby had complications. At the time, my mom had just died. At the time, my house had just burned down. Oh, you're right. That shit is horrible. I can't even imagine. When life happens, you need to reschedule that date. I know it's hard because so many of y'all got them dates in y'all mind and you just gonna go. Well, reality is, unless you're at the point where you have to take this test because it's going to expire literally. And I can't believe how many students I say, well, when is your expiration date on your ATT? And you don't know what I'm talking about. As soon as you get the authorization to test, go find out that expiration date, put it in stone, remember it in your mind, and schedule the test right before it. You can always push it up. You can change your date 7,000 times and nobody cares. There's no money out of your pocket, but put it closer to when it expires. And then if you notice that you are doing better, push it up. Push it up sooner. But for now, stop this mess where you are literally going to take a test despite the fact that all hell has broken loose. Now, I did have one young lady, she had been robbed at gunpoint the day before her test. She tried to call the board, write the board, contact the board. They were on some trash and being assholes. What do I mean by that? I mean that they did not give her an exception even with a police report. Now, that's some trash right there. That's some trash. So she had to take her test because you know and I know you got to cancel that test within 24 hours. You can't do it in 23. You can't do it in 23.5. No, you about to take a test now. It is what it is. She definitely failed for a really good reason, okay? Y'all feel me on that? Okay, now let's go again. What is another reason that your personal background made you fail? Like it helped you fail. Well, anxiety is real. I have a young lady right now in class. She's getting 80s on her test. She's taking an LPN exam. Her anxiety is way out there. Anxiety is real. And what can you do about it? You can do a lot about it. And again, this is my opinion. You better talk to your doctor, okay? Because you know if I don't say that, somebody be suing somebody. But no, I'm telling you, you can do this. How do you do this, Shelly? How do you conquer anxiety? Number one, and don't underestimate what I'm about to say. Number one, you have to know the shit. So what do I mean by that? Well, if I ask you right now, what's 2 + 2? You gonna look at me crazy and say 4? Yeah, with that same like, okay, that look, right? Because you're like, bitch, why you asking me this dumb shit? Here's the deal. You didn't come to earth knowing what 2 + 2 is. Oh no, honey, you had to learn that. And matter of fact, if you really go way back and think about how you learned that, it was flashcards. It was flashcards, it was studying, it was drilling, and you learned it. Now, when I ask you what 2 + 2 is, your armpits don't sweat, you don't get bubble guts and diarrhea, you don't have tachycardia, you don't get a headache, your eyes don't do switchy swatchy things. No, you say 4 with the, what you asking me that for? Oh, okay. Well, that's exactly how you got to know nursing. You've got to do everything you can to make this anxiety not an issue, because when you get to the test and you get the first question and you see you already know it, you get a little boost to your confidence and a little decrease in your anxiety. And so now you got the second question. You're like, bitch, I know that one too. Now it's rolling for you. But when you don't know the material, and that first question hits you upside your forehead, and you're like, what the fuck is this? I've never seen this. I never learned this. School ain't never taught this. I ain't never heard it. Where did they get this from? Your anxiety goes higher every question you get. And you guys don't know this, but let me tell you a little secret. When you first sit down at NCLEX and you sit in that seat and you hide that counter and you hide the timer, because that's another way to cut down on anxiety. Hide the counter, hide the timer on the system before you start. So you got your little, you got your little instructions, and you're hiding the timer and you're hiding the counter. When you sit there for that test, here's what I got to get you to understand so you know why anxiety plays a role. When you sit there for the test, what they're going to give you, question number 1, swear to God, question number 1, 2, 3 on down, the initial first 5 to 10 questions will be some of the hardest in the test bank. Why, Shelly? How come you know that? Because remember how we said the test goes from 85 to 150? So if you got 85, you're out of there. If if you got 85 and you passed, you knew your shit. How could they feel confident to let you out of there in 85 questions? How could they say you are the bomb.com, get the fuck out, you a nurse? Because it gave you the hardest questions and you handled the business. When are they going to give you those questions? When you first sit down. Because if you're that nurse and you know your shit, they need to know it right away so you can get up out of here and quit wasting time. They're not going to dummy it down. No, they start off raw and hard. Now, if for the first 3 questions you miss them, oh, they're going to dummy that shit down real good. And you're going to be out of there in 85, which means you killed every damn body. This is a problem. Some of you even have PTSD. Stop going to the same testing center you failed at. Go to another testing center. If you took it at 8 o'clock, take it at 11. Have somebody drop you off. Do some different shit before you take this test so that you don't get into this PTSD. Some of you failed 7 times, 5 times. I already know that. I get it. Stop doing the same shit. You will stop getting the same result. Now, what can you literally do if that doesn't help? Because it may not. Because I tell you very often, propranolol is approved for test anxiety. And it's not a benzodiazepine. There's no risk for addiction. Your doctor's not going to look at you. Your nurse practitioner's not going to look at you cross-eyed like you dealing drugs on a side street, because propranolol is not a high abuse drug, but it is approved for test anxiety. Now, you may not qualify for it, so don't be going nowhere demanding nothing, because if your blood pressure is typically low, why would I give your ass propranolol? It's a beta blocker. It's going to drop it even more. But it is approved for certain people for test anxiety. If that's not going to work, because again, maybe you don't qualify for it, then you got to step up and think about some Ativan. And 0.5 of Ativan usually works best for a lot of students that I talk to. Again, this is my freaking opinion. Okay, so you have to look at something. You cannot, absolutely cannot go to this test and just let anxiety take you over. I would also say that you have some kind of protein that morning, like a hard-boiled egg or a little bit of sausage with scrambled eggs, or, you know, proteins carry you through the test. Here's what don't carry your ass nowhere: sugar-filled coffee, donuts, Danish, muffins. That shit don't do real well, okay? It just doesn't. I'm just trying to tell you what it is. You also need a good night's sleep. Don't study till your eyeballs fall out their sockets. Take your ass to bed. You may not be able to sleep, but take your ass to bed. Try. If you have to take a little melatonin, you know, the night before, make sure you take it by 8 or 9 o'clock. Don't take it after that. You ain't gonna work so well. Okay, I'm just saying this is my opinion. Okay, now, oh my God. I have talked to too many people in the last 6 months about the 45-day rush. Tell me what makes you think that after you failed this test that you was going to be ready 45 days later. And then some of you had told me that you passed your test, that you graduated from school in 2022. Keep in mind, this is 2023, about to be 2024. Some of you told me that you graduated in 2022, started testing in 2022, and we ain't nothing but 2023. You already took it 10 times. That's because you are crazy. You done took it every 45 days. That 45-day mark is the least amount of time that you could spend before you take it again. That is not the guideline for when you take it again. As a matter of fact, let's think this through. Most of the states in this country, when they send you that authorization to test, most of them give you 6 months to a year of expiration from that date. So in your email, let's say it came to you November 1st, you're going to have 6 months past that date to take this test. Why would most states give you 6 months to a year? Because it takes a while to study, fool. They didn't say it expires in 45 days. They said 6 months to a year. Stop taking the test every 45 days. No more of this. Please stop it. Okay. Now, we handled the why. This was your personal risk factors for why my sweet students fail. Okay, now let's handle the what. You can't do what you used to do. You failed. Now you are on the hunt for the candidate report that is coming. It's either going to get mailed to you or it'll be emailed to you. 90% of you will have it emailed right in your email, so you always have it to reflect on. What did you used to do? When I just said, you can't do what you used to do. What did y'all used to do? You used to burn it for firewood. You used to tear the shit up and throw it out. You used to swallow it whole and vomit it back up. You used to let the dog shit on it. Seriously. You just did not have no patience for this stupid ass report. And one of the reasons why you didn't give a damn about that report is because you didn't know what that report meant. You had no idea what those terms meant. And I almost want to ask the Board of Nursing, what makes you put these stupid terms on the candidate report in such a way that don't nobody know what the fuck that is? So here we go. Come on. 3 ways. Remember what we're doing. You failed. You're looking for 3 ways to never fail again. We took care of 1 way. We looked at why. Why personally did you fail and your best friend didn't? What is the next step? So this is step number 2. What did you fail in? What didn't you know real well? What had you tripping on a test? Now, let me remind you, you're going to get your candidate report. You have to really look at it. It's going to have 3 values. First, it's going to say how many questions you even got. And then it's going to have 3 values. It's going to have near, I should start the lowest, right? It's going to have below, near, and above. The aboves that you see, God willing that you got any, the aboves that you see is basically saying everything we asked you about this category, you was on point, you knew it, and you got a lot of the higher level questions correct. The below is just the opposite. You got almost everything we asked you on this topic wrong, like really wrong. Ooh, especially the lower level questions, okay? The near is really confusing to a lot of you. I get the calls all the time that say stupid stuff like, yeah, I almost passed, Shelly. I don't need much. I got all nears. No, you didn't almost pass. You're nowhere near passing. The person who almost passed has aboves and nears and no belows. Or like one lady I saw, all aboves and only 1 below. You had all nears. There's nothing on the test that you knew well enough to pass it. You failed every single one of those topics. You had some knowledge, but damn sure not enough to be a nurse. So how did you get all those nears? Why did they use that language? Why didn't they just say below? Well, because you got the dummy down questions, the lower level questions in that topic. You got those right. But the minute the difficulty picked up, you fucked it up. You didn't know it. And so we know that that is a student who did questions mostly, no content at all. They did not watch the videos, or they did not have good teachers, or they did not go to a good school, or the lectures in their school were trash. You know, the schools that tell you to teach yourself, that's what I'm talking about. You paid that $45,000, that $62,000, that $110,000, and the motherfuckers told you to teach yourself. Essentially, you had to do all the information finding on your own. And if you went to school during COVID, you didn't even get clinicals. I already know that. I know. That's why I'm here. That's why I put the entire nursing school curriculum. Hear me clearly. I put my entire nursing school curriculum on this channel for free. All under playlist, every subject you want, because I know that you were screwed. And my ministry is to teach, to educate, to give you the knowledge, to get out here and enjoy the life I have. I love nursing. It's the best career you ever gonna find. It got me out of an abusive relationship. It made my kids travel abroad. It gave them the best schools, Spelman, Ohio State. I love nursing, and I want that for you, but you gotta work with me. So come on. What did you fail in? Oh my God, let me tell you something. Back in the day, the #1 area of failure was basic care and comfort. It is now tied, and this is new, it's tied with reduction of risk. And I almost think reduction of risk is inching it out for first. These two are a lot alike. Some of the things we do for the basic care and comfort of the patient are actually fitting in reduction of risk. Now, I already have a basic care and comfort video, so you got this. Now we're talking about reduction of risk. What is reduction of risk? What in the world is that? You know, it's procedures. It is procedures. It is, and stay with me. Look, y'all, I wrote it all down. If you're able to take notes on this part right here. I wrote down what is reduction of risk. And in this packet that you know I have for you, everything I'm about to say is already in this packet. Reduction of risk is blood transfusions, putting in an IV, so venipuncture. It's central lines, it's chest tubes, it's anesthesia, it's trachs, it's O2 therapy, which mask to use. It's chest physiotherapy, pats and claps. It's incentive spirometer, suck the balls. You know I had to slide something crazy in there. Yeah, incentive spirometer is suck the balls. Peak flow is blow the balls. That was for free. Here we go, stay with your girl. Reduction of risk procedures also include Allen's test, enteral feedings, ostomies, colostomies, ileostomies, right? Ileostomies, okay, that's all I'm talking about. Oscopies. Oscopies is a big one. Colonoscopy, endoscopy, hysteroscopy, cystoscopy, colposcopy, ERCP. Huge on the test. Enemas. Here's some more reduction of risk, reduction of risk and procedures, right? Synthesis. What kind of synthesis? Amniocentesis, paracentesis, thoracentesis. Urinary catheter insertion, male versus female, totally different insertion technique. IVP, intravenous pyelogram, KUB, kidney, ureter, bladder x-ray. Cystoscopy, dialysis, both peritoneal and hemo. Medication administration. How do you give an EpiPen? Can you give it through the clothes or not? And should you give it in the thigh or the arm? Ears and eye drops. Again, more procedures. Reduction of risk. Here's some more. Drainage devices, your Jackson Pratts, your Hemovacs, right? So all of those types of things make up this test, this reduction of risk portion of your test. Here we go. Staple removal. CPM, your continuous passive motion to prevent the DVT. SCD, sequential compression devices to prevent the DVT. TED hose, canes, walkers, crutches. Restraints, fire safety, race, and pass. So, race, rescue, activate alarm, contain, extinguish. You have to know that, okay? EKGs, EEGs, EMGs, and CTs. What did I just say? Electrocardiogram, electroencephalogram, electromyogram. If you don't know those, you better talk to your girl. CAT scan, MRI, what's the difference? TTE, TEE, what's the difference? Transthoracic echo, transesophageal echo, what's the difference? LVADs, VQ scans, Glasgow scales. Oh, by the way, they're all in here. So if you failed procedures, which is reduction of risk, if you failed in that category, you damn sure can't do the next test without this. And I do have a special for you. It's at the end of the video. You hit subscribe. We'll hook you up, but you're going to need to listen. So listen. Y'all got short attention spans. Want to click the video off after 3 minutes. Basic care and comfort. I already did a video for you. If you need the handout for where to find basic care and comfort, here's the deal, guys. It's always been right here in your Oh My God packet and in here in your reduction of risk. These two together make up basic care and comfort. Hello. All right. I got a treat for you. The third most commonly failed area that is totally different from the old test is pharmacology. Now, why? Because they put more pharmacology on the test. This NG and NCLEX is more pharmacology, more infectious disease. So you got pharmacology now being failed quite a bit by a lot of students. And the thing is, you got to remember, I combine a couple things. I combine psych, which is another area of failure, I combine these two for one reason. You see these, right? Psych meds, pharmacology, medication categories. You see those three. The reason psych meds is included in your need to study for pharmacology is because 70 to 75% of all meds on NCLEX are psych meds. The other percentage is made up of cardio and a few GI and some sprinkle of crap along the way. But psych and cardio make up most of the meds. So therefore, when you're thinking of pharmacology, do not sleep on psych meds. So if you were to look at the UWorld software, they have a special section just for psych meds. Now, I don't know if you've ever noticed, but when you get this candidate report and it tells you what you failed in, psych is the only subject that they pulled out and put it by itself. They didn't pull GI out. They didn't pull cardio out. They didn't pull musculoskeletal. They never pulled cancer. They didn't go after anything else but this actual subject by itself. And why is that? Because it doesn't matter if you work in newborn, if you work in maternity, if you work in peds, if you work in GI, if you work on a tele floor, if you do med surg, if you're just doing outpatient, if you're a school nurse, it doesn't fucking matter. No matter which one of those you work in, you're going to get crazy on steroids. You're going to get some cray-cray folks up in here. You're going to get some psych patients in here. So it doesn't matter. So they put it on every test and you guys aren't doing well with it at all. Now, you know I got a psych playlist. It's got every single psych subject. So, you know, you might need to go visit that playlist. So these are the subjects now that people are failing in. And you got to kind of think, oh no, we can't have this. But there's one more that I want to share with you. And you know yourself that one of the problems is with COVID, y'all lost your mind. Yep, you did. Hold on, I'm going to show you how you lost your mind. You lost your mind because when you went to go do this test and COVID came out, not only did it destroy your attempt to do anything in clinicals, but it also made you crazy as a nurse. What am I saying? I'm saying that now that we had COVID come out and mess up the whole game, you guys have shown yourself to be a little less educated than the other people about how infection spreads. Now you got more infection control on this test. And so, you know, I'm going to say it. You know, I got what you need. You know, the fact that you don't know your infectious diseases is something I care about. I've been teaching it for 20 years. I watched the COVID information come out and roll my eyes because so much of it was crazy. And a lot of y'all was spreading fake news and it was just horrible. So these, if you just really look, all of this kind of stuff that people are failing in, this is like pink packet stuff. You might have heard me talk about pink packets. So I'm going to hook you up in a minute. Health promotion and maintenance. Yeah, you don't know too much about that. I've seen it where you just do not get what that is. You don't understand that health promotion and maintenance is maternity, growth and development, pediatrics, geriatrics, vaccines, cancer screenings. That's what this is. That's exactly what health promotion and maintenance is. And then, of course, we got management of care. And management of care is like 18-19% of your tests, right? So you got who you see first, ethical, legal, SBAR. In management of care, you also have roommates. And you had to know workplace conflict, interdisciplinary practice, evidence-based practice. All of that delegation is in management of care. But you already know what I'm going to say. Almost everything I just said, yeah, is already in your Oh My God packet. So I would say that if you have totally gone sick with this test. You're just tired. You don't have any more money. You don't have any more patience. You don't know what to do. You okay. This is what you're going to do. I said I was going to give you 3 ways to never fail. I gave you the why, possibly you personally failed. I gave you the what you might have failed in. You're on the lookout for your candidate report to see what you failed in. You can give me a call if you need a consultation. Now we in prevention mode. Now we about to break it on out. Now we about to kick this test. Now we about to make NCLEX our bitch. Here we go. How do I never fail again? You have a playlist on my video series called Self-Study. Everything I'm about to say is in the self-study. It's no need to purchase shit. It's in the self-study. Here we go. 1 subject at a time. Every nurse must have a system for how they pass this test. You know how you looked at all the notes you got from school, and then you saw some random videos on YouTube, and then you bought a little bit of software. You got the code from a friend who had some left over. No more of that. You have got to get a system down. Your system has to be in order. You have to take these doggone subjects and you have to master them. You have to look at page 4 on the Oh My God packet. And you have to look at every single one of these subjects and you've got to master them. And you have to get to the point where you check them off once you've mastered. It's not enough to do 1 at a time. You got to do them in the right order. Here is the order. Notice what order is first. Which subject is first? Psych. Psych is first by design because guess what? You keep failing it. So we're going to kick psych's ass first. Okay, so 1 subject at a time. You're going to go to YouTube, but we have to be systematic. I may not be the best, but I'm the most organized on YouTube. I know this for a fact because I've looked at everything. On my YouTube channel called HETV, you go straight over there to that playlist and you recognize the fact that I have my shit all systematically in order. Here's what I tell my students when I'm teaching them what to do. I say the playlist is your textbook. Open the playlist, there's your chapters. So right now, if you go to my psych playlist, you're going to see 9 chapters in psych. One of the psych chapters is going to be all about depression. One psych chapter in the playlist is going to be about bipolar. One is going to be about personality disorders. Another one's going to be about schizophrenia. Another one's going to be about OCD, PTSD, eating disorders, alcohol and drugs. Chapters. So organized. Take notes on videos. You looked at schizophrenia. It don't matter if you didn't take notes. You have handouts available through my link for every single playlist. If you can't afford that, I get it. So what? Buy you a 5-subject notebook and get to writing. Do 5 to 25 questions all day long. This gets confusing to you, so I'm going to spell it out. Today is the 10th of December. You are listening to me and thinking, I already got you, world. I'm about to do what she's talking about right now. You go to the psych playlist because I said start with psych. You watch the first video, which is personality disorders. You leave that video and go do 5 questions in UWorld. Today's the 10th. You ain't done. You go back to the playlist. You watch the next video, which is depression. You got time on your hands. It's Sunday. You go back to UWorld. You do 10 questions on psych. Boom. Look at the rationales. Take notes. Whatever. You doing this. Now, you still got time on your hands. It's just Sunday. You ain't got to work. You watch another video. That video is on bipolar. You do some more psych questions on UWorld. How many more, Shelly? Anything you want to do, but not more than 25. So by the end of the 10th, December 10th, today, by the end of today, if you start right now, you've watched 9 psych videos and you've done 15 tests, but none of the tests that you did had more than 25 questions in them. Some had 5, some had 10. You did one with 25. You thought that was like a little bit too much for you. I would agree, because I like to do 5 or 10. And you went on back to down to 10 and 5, and you started really doing this shit. You started watching the videos and taking notes. You started doing the questions and reviewing the rationales. And you didn't just review the rationales on the questions you missed. You reviewed every single rationale because I said so in number 5. You reviewed and took notes on the rationales. If you do more than 25 questions at a time, this is going to take 2 days. You don't have 2 days. You have to really learn this information. And for some of you, you're learning it for the first time. So again, watch the video, take notes, do some questions, review the rationales, take notes. That's your system until you pass. Uh-oh, this one gonna piss you off. Maybe it'll help you, because a lot of you got fucked on these software. Even UWorld is on some trash with this. Archer definitely, UWorld also. What are they doing? They telling you you got a good chance of passing, and all your little ass was getting is 60s and 65%. Bullshit. Yeah, it's bullshit. What do you need to really pass? If you're an LPN taking an LPN test, you better strive for 75. If you are an RN taking an RN test, you need 85, and there is no debating this issue. We can't negotiate. We can't discuss that score. We can't cheat a little bit. We can't go ahead of time. No, we need 85 or sit your ass down. This is what I do. You looking at me right now. I'm helping you. I got the PhD. You failed the test. Let's get it together and do this shit, because I love you and I want you to be a nurse. That's all I'm saying. Now, if you listening to this crazy ass video with this whacked out lady, and you literally lasted to the end of this video, I got to hook up. Look at here. I told you to start with psych. Psych meds. I told you to start with that. That was 2 packets. I told you, if you want to learn basic care and comfort, and you want to master some of the concepts under management of care, I told you they were in the Oh My God packet all along. That's 3 packets. I told you that reduction of risk is very quickly becoming #1 area of failure. I told you that everything under reduction of risk on my board that I went over thoroughly is in this packet in the order that I wrote it on the board. That's 4 packets. I told you that they're putting more medication on the test, screwing up a lot of y'all because you didn't anticipate that, and now you failed in pharmacology. This makes 5 packets. So let me show you what the hell I'm talking about. You get the Oh My God. You get the reduction of risk. So Oh My God, reduction of risk. You get medication categories. What's so special about this? I just revised it. And you get your starting place, psych meds and psych lecture. You get all 5 of these for $35, just for a limited time. How do you get it? Just so I know your ass went through this whole video. Here you go. This how you get it. You can't email me, you gotta text me. 216-410-0936. I only take Cash App or PayPal. I do not do Zelle. Don't call me about your little Zelle, because I don't do Zelle. So I'm telling you right now, Cash App, PayPal, $35 for medication categories, the Oh My God packet, reduction of risk, psych meds, and psych. 3545. Give a sister a call. I got you. You don't need to buy it. You don't have to have it. You can use notebook paper. But if you're thinking it might help, go on and hook your sister up. 3545. Think about 95 on today's game. Miles Garrett, shout out to you, boo.